Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Welcome to this edition of TIP Media's panel discussion. There's very little awareness amongst the public regarding organ donation in India, and this has led to a lot of myths and misconceptions about organ donation, and therefore I think it's been very slow in India. Not many people are aware of organ donation and not many people are willing to donate organs. So since August 13th is Organ Donation Day, TIP Media attempts to spread awareness about organ donation in India. And for that, we have two experts today with us. Dr. Harsha Jauhari, Senior Consultant in Organ Transplant Department of Artemis Hospitals, New Delhi. Welcome to you, Dr. Harsha Jauhari. It's lovely to have you with us.
Thank you so much.
Mrs. Pallavi Kumar, Executive Director for the Delhi NCR region of MOHAN Foundation. Lovely to have you with us, Pallavi Kumar. Welcome to this program.
Thanks for having me.
And if you can just quickly tell what MOHAN stands for, because MOHAN I know is an acronym and it's something to do with multi-organs, right? So what is it?
So MOHAN, like you said, is an acronym for Multi-Organ Harvesting Aid Network. Of course, we used the word harvesting at almost 25 years ago, and we're not so happy about the word harvesting anymore. I'm hoping to find a better word with H that we can slip in. But yeah, it's an organization that has been working to promote deceased organ donation. It's our 25th year now, so it's a silver jubilee year. Yes.
Oh wow! Congratulations on that to you and to your team. Let's start with the question and answers, and I'm going to start with questioning Dr. Jauhari. What are the most common and least common organs harvested in India, and which organs and tissues can be donated while a person is alive and after death?
Good morning, everyone, and it's a pleasure to join all of you for this meeting. So, especially when it's coming on the Organ Donation Day. Now, you asked a very important question. What is it that can be donated? Kidneys, liver. These can be donated from a live donor, and these are the most common ones. The least common ones are when you are taking the organs from the deceased donor. The common ones still remain the kidneys and the liver, and the least common ones are the intestines and the lungs. And the heart is also being used now fairly commonly. Not very commonly, but it's becoming more and more common. In the tissues, in real life, you can take probably some skin occasionally, but other than that, tissues normally are not donated from a live donor. In people who are deceased, you can take the eyes, you take bones, you take skin, and you can take also in, shall we say, some blood vessels and nerves which people are using. And you also take what is called composite tissue. That means, for example, a hand or a foot or a toe, where it's a combination of everything, skin and bones and nerves and arteries and veins. So that also is gradually picking up steam, and people are getting very good results. So this is what you can get from the deceased donor.
Okay, that's wonderful to know that so many parts and organs of a human body can be actually given to somebody else to live better. Thank you so much for that answer. Pallavi, the next question to you is, can you throw some light on the process of organ donation in India? And if at all it's failing for whatever reason, why do you think it is so?
So like Dr. Jauhari said, there is living donation where a person can give one kidney and a portion of the liver. And then there is deceased donation after death, which so far in our country is happening in the case of what is called brain death, which is really some kind of an injury to the brain or something that is causing some bleeding inside the brain. The person is rushed to the hospital. Because the breathing is compromised, the person is put on a ventilator, and then the doctors try whatever they can to stop the bleeding and swelling inside the brain. But if it so happens that they're unable to do that, and the oxygen supply to the brain is cut off and the brain dies. This is what is called brain death. The brain has died, the entire brain has died. However, since the person was put on the ventilator before the person's brain death occurred, the ventilator is still pumping the heart and organs are still getting oxygenated blood. So this is a very unique situation where the person has died, the person is no more alive, but the organs are still functioning. And so it's important to remember the person is in a hospital, in an ICU, on a ventilator, and has died, but the organs are being artificially kept alive. So this is a situation where we approach the families and request them to think about organ donation. And by no means an easy job. I mean, I must have spoken to so many families in the last 12 years that have been in this field. And har bari wo ek नई हिम्मत जुटानी पड़ती है, because it could be 100th conversation, but for this family, it's a very fresh grief. They've just lost somebody, they've just lost a loved one. And also, Sheila, important to understand, if you look at a brain dead person on a ventilator, the chest is moving, it looks as if the person is still breathing, it looks as the person is perhaps in coma, in some deep state of unconsciousness. It's very difficult for families who have not understood the concept of brain death to accept death, because they think, oh, but the person is breathing, and then for them to understand that this person is dead can be difficult. And if there has been no conversation on organ donation prior to this moment of intense grief, then this is an additional decision that they have to take. And very often the easiest resort is to say, please, hame ye sab baat nahi karni, ab aap hamari body वापस करते हैं, या whatever. So this is a situation in which organ donation as of now is taking place in India, in the case of what is called brain death. Dr. Jauhari may want to add something to that.
Yes, so what you're saying is it's really difficult to convince people to donate organs, and I'm glad you brought out that point about how difficult it is for you and your team to talk to the families, right? In fact, that is one of the questions that I have with me for you, Pallavi. It must be quite emotionally challenging for you and your team, of course, to convince the families to donate organs. So how do you deal with it?
I guess one is constantly looking at, so every time a family does say yes, and the good that comes out of that one yes, and the number of lives that are saved, and number of the families that are transformed, and that's what keeps you going, So while there are a lot of no's, reminding yourself of the yeses that you've got, of these extraordinary families who did decide to say yes. And believe me, it's not easy. When a family says no, that seems like the more logical answer to me than when a family actually rises above its grief and says yes. So yeah, the fact that you could be someone who could be instrumental in making that yes happen is what keeps driving me day in and day out, at least personally me. Yeah.
Oh, that's wonderful. And thank you and your team for such good work that you're doing. Dr. Jauhari, the next question to you is, there's a lot of fear and taboo associated with organ donation. What are the risks associated with an organ transplant surgery, both for the receiver as well as the donor?
Okay, a very important question which you have raised. The recipient is having every single complication and comorbidity you can think of. Most of them are diabetic, they are hypertensive, they've got kidney failure, they've got uremia, they are hypoproteinemic, they have anemia, you name it, they've got it. So it's not as if we are jumping into a well with them. It is calculated risks we are taking, and you have to make them as fit as you can for that operation. You cannot keep them for very long at that level of fitness. So you have to bring them up. For kidney patients, liver patients, many of them are in literally what is called fulminant hepatitis. That means they cannot survive if they don't have the transplant. In the next few days, they will pass away. So the question of making them fit is not so good. Heart, lungs, same thing. So there is an inbuilt risk, but it is a calculated risk. It is not a shall we try it and see whether we survive kind of risk. And God has been very kind. Kidneys, your survival should be as good as any other operation. It is like crossing a road or sitting under a fan. And recipients also, by and large, should not have any major problems, except that in surgery, anything can happen. As far as donors are concerned, live donors, by definition, the person has to be normal. And it's very easy to find illness in somebody. I can look at anybody and find five illnesses, even you on a photograph. But to call you normal requires a whole lot of investigations, probably more than that of the patient himself. And our responsibility for the donor is more, because you are normal. We cannot make you ill to make somebody else better. So that is why the law also comes in. You know that there's no other field of medicine or surgery where the law steps in, because there is a donor who is normal who is involved. So you have to leave him normal. Now, obviously, there's an inbuilt risk. My responsibility for the patient is that he is ill. I'm trying to make him better. My responsibility for the donor is that I have to declare him fit and I have to leave him fit. So I can do no harm. So the responsibility is huge, and all of us make every effort to make sure. And then again, God has been very kind to most people. Donors do well, and it's a disaster if you have any kind of problem. It doesn't happen very often. But as I said, it's the same kind of risk like crossing a road or sitting under a fan. So the exaggerated fears are there in the mind. People do like to talk horror stories, but horror stories are just that, horror. They don't happen so often. Yeah, we usually get good results. Let's put it that way, in the high 90%. Okay.
Yeah, very well said, Dr. Jauhari, and I hope that will encourage people to donate more. The next question is also addressed to you, Doc. Can age and blood group compatibility be a factor for organ donation? And also, if people you just said that people should be normal completely to donate organs, but let's say they do have some kind of a health problem which does not directly affect the recipient. In that scenario, can people donate organs?
So let's start with the blood group. Blood group used to be a big bugbear a few years ago. Now we have begun to cross the blood group barrier fairly routinely, and is the ABO incompatible group. So nowadays we are crossing for kidneys, we are crossing for liver routinely. The results are virtually as good as those who are having the same compatible blood groups. So normal mismatch is the A and the B. Yeah. So people are able to get that incompatible. But again, we have an alternative solution for that. We have what is called the swap, or it's a bad word, but basically it's a crossover. Two sets of people with one donor B and one donor A. So you cross over and give to each other, and then you have that also. So that's widened the pool. So that's first. Second is age. Now, extremes of age, uh, I think it is largely uh, exaggerated, because this started way back in the 60s and 70s, that Greek grandfathers and mothers, you insisted that they will give the kidneys to the grandchild. They said, I'm alive, why should my son give to you? I am responsible for the grandchild. So they used to give, and the results were pretty good. So it gives people confidence. When I started out in transplants way back about in mid 80s, yeah, at that time 60 was the upper cutoff for receiving a kidney. Today, if you say it, you'll have a revolt. And same thing with donors. Used to say it has to be 60 upper age limit. Today, people are happily giving at 65 and 70. So as long as they are fit, it's a value judgment, and people are giving it and taking it. Now comes the bit about the disease which you mentioned. Many people are, for example, developing hypertension or diabetes. They become what is called a marginal donor. Yeah, nobody is going to be perfect above the age of 40 or 50. Somebody's going to have some problem or the other. And if you have no other donor available, then we take a calculated risk. A recent diabetes, a recent hypertension, by all means, we can definitely have a donor who's had malignancy of a certain kind, which is now taken care of. 2 years have gone by, 3 years, you're cancer free. You can be a donor. Yeah. Similarly, you have got people who have got, for example, a hysterectomy done or a mastectomy done, or they had a gallbladder surgery done. If they got an appendicitis, would they be fit for a surgery? Yes. If they are fit for a surgery, then they can give a kidney. Let's put it that way. Yeah. So I'm not saying you should be casual about it, but it is part of, a donor is not just a kidney, it's a human being whose kidney we are after. Let's put it that way. So, uh, if the person is fit, otherwise up and about, and if they required an operation which you could give to them, if you can do an operation in illness, definitely you can do it for a person who is otherwise fit and in health. So it's a value judgment. It's a value judgment, but yes, we do have a lot of marginal donors now, and they're doing very well. There's no problem with that.
Okay, that's
And if I
wonderful.
may add to that, Sheila, we get
Sure,
asked
please.
this question very often in our public awareness sessions, this whole thing around till when can we donate? And our only message to the people is you just decide whether you want to be a donor or not. And when death occurs, 10 years later, 20 years later, 40 years later, tomorrow, at that time, the team will assess whether your organs are in a situation to be retrieved or not, and only those organs that are going to be used are going to be removed. And while Dr. Jauhari brought this up a couple of years ago, Mr. Tej Ramji, who was in the board of directors of Sir Gangaram Hospital, had a brain death, died, and the family was very keen to donate organs, and we thought 88, what could one possibly retrieve? And he had lived a healthy life, and both his kidneys and liver were retrieved and used for other. But then it won't go to very young people, right, Dr. Joy? It could go
Absolutely. Yeah. See, I was one of the people who retrieved them and used them, because while I'm at Artemis as well, I'm also heading the transplant at Sir Gangaram Hospital. So,
Oh, okay.
yeah, so that also
and
is
more
there.
recently in Max, there was a 90-year-old man who's
Yeah, yeah. So there are no absolutes. There are no absolutes.
absolutely.
Yeah. This is wonderful information both of you are sharing, and thank you so much for those inputs. Dr. Jauhari, again, I'm going to ask you, taking off on that point about cancer patients being able to donate. This probably would be news to a lot of our viewers. Because you said cancer patients who are completely cured and probably 2 and 3 years have passed, they can donate organs as well. But do you think there is a fear amongst the recipients that they might also become, cancer patients going forward because they're just receiving from a cancer patient who's a donor?
You see, it works both ways. I mean, you've got a recipient who's got cancer, who is cancer free for 2 years, 3 years. Should we give them a kidney or a liver or not? We do. So the old disease may or may not recur, and then you blame it on the transplant. So, it works both ways. The question is, you need a transplant, there are some inherent risks. And when people ask me, I mean, this is on the slightly lighter side, they say, what is the guarantee? I said, none whatsoever. Because statistics, I can prove anything.
Right.
Yeah. But on the other hand, if you are successfully transplanted, for you, it's 100% success. And if it doesn't, then it's a 0%. So as far as you're concerned, I'm the best surgeon if you're doing well, and I'm the worst if you're not. So statistics can prove anything. So I wouldn't worry too much about that. But yes, your doctors normally are so intensely involved in the management, and people like Pallavi, of course, who guide the patients so well that nothing is done casually. There are checks and counter checks and rechecks, and by the time the patient gets the actual surgery, the patient has been through a sieve. So I think it's not, nothing is done casually.
Yeah, I'm sure. And thank you for that answer. Do you have any activities to promote organ donation from MOHAN Foundation?
Two things. A, we have been doing well. If you look back at the last 7-8 years, there has been an upward graph, save COVID times for a little while, but slowly and steadily we are doing better. That's one thing to know. And the second thing to know is there continues to remain a huge gap between demand and supply. So there is, of course, a large number of people on the waiting list. As against that, we are not being able to generate as many organs and organ donors as ideally there should be. A multitude of factors, health is a state subject. That state's willingness to support this program the medical standard of that particular state, the number of hospitals that are doing transplant, what kind of thrusts that are given, what kind of training that is given of the medical fraternity, what kind of education of the medical personnel, a number of things decide what kind of donation rates that particular state will have. So we continue to do all of these things: public awareness, engagement in the media, doing various activities, a lot of training. We are very, very strong on training of this group of people that are called the transplant coordinators. These are people who actually coordinate all the living donation and deceased donation activities in a hospital. Training of the critical care staff that will identify brain death, declare brain death, and maintain brain death, and training of the neurosurgeons. So, and also working on the larger ecosystem to make it conducive to organ donation. So yeah, but it's not just one entity alone that can make it happen. Particularly this cause is one that requires a number of stakeholders get together to make that one donation happen.
Yeah, I'm sure. Thank you for that information. Dr. Jauhari, if an organ donor dies, what are the steps that family members can take to harvest these organs? And what is a time frame within which that decision has to be made to donate the organs?
See, there are two kinds of deceased donors. One is the brain stem death, and the other one is the cardiac death, which we are all aware of. The person stops breathing and he stops having a heartbeat. Now, that at home really will give no chance to anybody to do anything at all, except that they can possibly, donate the corneas. People can come home and take the cornea. Because by the time anything is mobilized, it's going to be too late. The organs will have been without oxygen for a long time and they cannot be removed. On the other hand, when you have people who have got brainstem death, they cannot be diagnosed at home. They are either road traffic accidents, or they are accidental deaths, electrocutions, whatever it is, or they come into the hospital and for a variety of reasons they develop brainstem death, usually trauma. Now they are on ventilator and they are being monitored in the ICU by teams and teams of people, and then it takes one step and then the next step, and you have four people diagnosing a person as brainstem death separately, then 6 hours later again. So it is 8 separate examinations before you can declare somebody brainstem death. By this time, the family has been exposed to the concept of brainstem death. Now, this is what Pallavi was saying. Earlier, we were talking about, public awareness. Now we have gone past that stage now in terms of public awareness. Virtually everybody in the country has heard of Angdan, like everybody in the world has heard of COVID. Everybody has heard of Angdan now. Nobody can plead he does not know, right? Angdan is there. Everybody knows. Question is, are we now organized? Is our system in such a way in place that one leads to the next? The transplant coordinators are being trained on a much larger scale now. Earlier, the concept of bringing in a transplant coordinator was difficult. Now we have got this question: how to make them better and better, and to break up that group of a single transplant coordinator into a donor focused one or a recipient focused one, or whether you are having a person who's called a grief counselor, just a grief counselor. Now it's a very huge thing to do. Now those people are already in touch, the patient is already aware, or the family is already aware. So when this happens, they are mentally prepared. So really, a brainstem death at home is a non-starter, and picking people, from home, I think the best you can do is corneas, because then the people go home and pick up the eyes. So all this has to take place in centers which have been so designed. And now we have widened it from being transplant activity of donor and recipient at transplant centers. You have started what is called an NTORC, non-transplant organ retrieval center. Yeah, that means any hospital which is a trauma center or which has got ICU and some beds and a good OT, if a person comes in, they can be declared as a donor center and somebody will go over there and help declare the person brain dead. The organs can be removed from there and then moved to the transplant center. It's a huge organizational thing. It is taking place. And even as we talk in the last, when we first started out, can we do a transplant? Now it is how to increase the numbers. Now you say how to make it more efficient. You got the police coming in, giving you these green corridors. You have got, organs shooting all over the place. You've got drones coming in now. You are working about whether you can take, you know, short hops in the city from one hospital to the other. Next will be from one city to the other. So, a lot of activity is going on. Unfortunately, or fortunately, the public only sees the tip of the iceberg. And there's a lot of hard work going on, and it is in the face of a lot of resistance as well, because funds are short. Governments have to find allocation of this money for this purpose, but the fact still remains it is very important. I mean, for example, one tenth of India has got some degree of kidney damage. Yeah, it's
That's
a
huge.
it's huge, and out of that, every year about 1 lakh people have kidney failure complete. So we are talking crores of people who have got some degree of kidney derangement, and we don't know it. So it's a very large problem. People are aware of it. People are working very hard, and that's why programs like the one you are conducting at the moment is so important. Myths have to be removed.
Oh, yeah,
That serious
absolutely.
work is going on. It's not as if somebody's trying to make money out of it. It's a government activity. You pick up organs from any one hospital, is allocated all over the city, maybe to the next city, maybe across to the next state. So no one person is sort of trying to make commercial benefit out of it. It doesn't happen that way. It just don't happen.
That's wonderful. I mean, it's so good to know that we've progressed so well, and there's lots more to do, but we are getting there slowly but surely. It's
Absolutely.
really nice to know this, and thank you so much for throwing so much light on this, Dr. Jauhari. That was very, very interesting. And okay, just one quick question on that NTARC that you mentioned. Do all the states have an NTARC? Center, or
NTORC.
NTORC, sorry, yeah, NTORC center. Do all the states have it?
The authority is there, the concept is there. The difficulty is to try to make a nursing home or a good hospital get involved in this, because if you have a donation taking place, that place looks like a war front in the next morning. Every place, the OTs look like nothing on earth because everybody's tossing things around, and those people have to be motivated one way or the other to get involved, because they get nothing in terms of apart from some publicity. So we are making an effort. It's all over the country, especially the trauma centers the government has put up all over the country. They are the ones which are going to be labeled. Each major city, also, the objective is that every medical college in the country should have some transplant activity, doesn't matter what. So you start making a department of transplantation medicine, which is what people are working on, so that you have people who are being trained how to remove organs from around. So it works on a hub and spoke model. So the big hospitals around which the nursing homes are there, they'll be attached, and then you can go and pick up. So you widen the donor pool. So these are all very ambitious things, and Pallavi is the one most importantly involved in it. And okay,
Oh, sorry. But Sheila,
it's
while we are at it, I just, since you asked that question as to how donation takes place, so while Dr. Jauhari very clearly conveyed that if there's a death in the house, you can't be a solid organ donor, organs that save other people's lives. But just about everybody who dies, save a few preconditions, you can be a corneal donor. And while I understand that organ donation is a bigger ask, I cannot for the life of me understand why 50 years of speaking about corneal donation, why people still resist eye donation. It's really a no-brainer. My own father, we donated his eyes. The team entered the house, retrieved his corneas, and left in, say, 19, 20 minutes. It's one of the smallest procedures. It's non-invasive. It doesn't cause any disfiguration. It doesn't cause any bleeding. It is easy to be done at home, in a mortuary, in a hospital, in a van. And really, every one of us who's listening to this program should seriously think about corneal donation, because it's been more than 50 years that we've been talking about corneal donation, and yet we face such shortage of corneas in our country.
Yeah, that's a great point, great addition. Thank you for adding that point, Pallavi. And I would encourage the viewers to not just think about corneal donation, but also much more. And as both of you have been saying, there's so much need in this country for organ donation, and I really hope that viewers will, kind of pay heed to this, to your good words, and do something about it in future. A few more questions. Um, Pallavi, this is for you. What are the legalities associated with organ donation in India? And what would you suggest if it's a very complicated chain of events? Do you suggest it to make it simpler, or are you happy with the way things are going?
So Dr. Jauhari sitting there, I dare not answer that question. He is the authority on law. He's the architect of the law, and
Okay.
I'll request him to address this query.
All right. Dr. Jauhari, your thoughts, please.
See, the law has intruded upon this particular facet of medical care. Yeah. Earlier, the first introduction of the law was to prevent commercial trade of any organs. Yeah. And we sneaked in the concept of brainstem death at that time. That was in 1994. After that, in 2004, we revised it and had the new amendments, which brought in a whole lot of things. So by this time, the awareness was there that the law should not be donor focused. The need is recipient based. So we changed a lot of things in that. I was one of the people, as Pallavi said, in a very high powered committee appointed by the High Court, Delhi High Court. So we the important things were we brought in, for example, that every hospital has to be registered. You've got to have transplant coordinators. Each hospital has to have a website. The decisions have to be taken in such a way that everything is transparent, allocation policies. You have to set up an organization which is now called NATO, National Organ Tissue and Transplant Organization. Yeah. Then we also introduced the concept of the National Organ Transplant Program, which is the overarching program over this, like malaria eradication, filaria eradication, whatever else you have. So you have an organ transplant program which is setting the infrastructure, training. Uh, you also had the concept of required request. Now, this personal, we are very emotional people, and if somebody has died, somebody is to blame. Now, it doesn't matter whether he's been hit by a truck, but somebody has died in the hospital, somebody in the hospital is to blame. So, if you at that time come and ask, can I have your organs? Chances are he'll beat you up and break up the hospital. Now, that is why we brought in the concept of required request, put up the signboard all over that the doctor on duty is required by law to ask for the organs. You are free to say yes or no, for God's sake, but don't beat him up, right? He's doing his job. So it made a lot of difference, because when families are sitting outside and seeing the patient inside, they read all these things. It makes an impact. So there's been some hard and soft thoughts going into the changing of the act. And now we are trying to move for what is called the Uniform Declaration of Death. Yeah, this is a very important thing. What happens is a doctor who has finished his internship yesterday and has just been registered, he can go up and certify somebody dead because he has got heart and lung, right? Heart and lungs are not working, so the person is dead. On the other hand, for a brainstem death, you got four senior doctors independently examining a whole checklist and then 6 hours later repeating it, and then they have to require to certify somebody brain dead. Now, this piece of document looks like half the size of War and Peace. You go around the country trying to show that somebody is dead, and they say, what on earth is this? Now, it should not be linked with organ donation. It is a mode of death, like cardiac death. So we are trying to bring in a single document saying so and so, so and so, so and so has died of so and so disease, etc., mode of death was cardiorespiratory oblique brainstem death. The documentation thereof is kept in the hospitals. But that single piece of paper then can be taken to the banks, can be taken to the cremation, can be taken to the registrar's office. So it gains currency. And incidentally, the people can then say, all right, we are giving organs or we're not giving organs. That also helps us then switch off the ventilator. Because this concept of people, as you write in the beginning of the program, you said about the person not looking dead because they got, respiration and this thing. But if the person is dead, it is proved that it is irreversible and permanent damage to the brain. The moment you take the ventilator off, within a very short time, all activity will come to a halt. So if a person dies because of heart or lungs or whatever, you start dismantling all the other drips and Rayleigh's tubes and catheters and drains and whatever. In this, because of this problem which people have psychologically, we've not been able to go across that. And then the question arises, is he really dead? Now the point is, he is dead. But can you switch off the ventilator? So it requires a little, that's our next big challenge. So we want this document to come inside. We are working towards it. MOHAN Foundation's founder also, Dr. Sunil Shroff, we're all, friends. We all started at the same time. And we're all working very hard towards trying to make this a possibility. And the other one, of course, is, I'm sorry, I'm digressing from, you were supposed to ask me questions, but the other one was, in India, we have got this tradition of Dehadan, right? Where you give your body. Now, patients come and say, of relatives, ki bhai, you take the body, use what you want, and then use the rest for research or whatever, scientific purposes. Organ transplant, for me, time is of great importance. I only want the organs. I'm not interested in something else. The whole body, what am I going to do with it? And the whole body, they want to give. So there are two separate acts. We are trying to bring it into one. So that if a family wants to donate the organs, we can take the organs which are required, and the body can then be used for training and scientific purposes. So these are things which are happening. So all for the good. I only suggest one thing, that all people who are listening to this program should sit at home in a non-crisis situation and discuss in their family that, God forbid, something happens to any one of us, what would be our wishes, right? And God forbid, if it ever happens, then you try to fulfill the wishes of the person, not your wishes or not your emotional needs. Then you can always say, you remember when we are talking that time, dad said so and so, or mom said so and so, or whatever. So that is one also very major, because in times of crisis, your reactions are not quite normal. So these things should be taken up in a time of non-crisis. But I'm doing Pallavi's job, so that's hers, not mine.
Well, I think both of you are doing a great job. Thank you so much for those inputs. Now, I have about 10 statements with me, which I will address to each of you. And if you can please tell the viewers if these sentences are myths or facts, that would be very useful. Dr. Jauhari, the first one is to you. Organ and tissue donation mutilates the body. Is it a myth or a fact?
Totally wrong.
Totally wrong. Thank you. Pallavi, religion bars organ donation.
When were these religions written? Where was there ever talk of transplantation and organ donation at that time? Religions say nothing about organ donation. They have nothing to say about organ donation and transplantation.
So it's a myth.
It's purely a myth. Please,
Thank
one
you.
should actively go down to their scriptures, speak to their religious leaders and ask them to show them where it's written that it's not allowed.
Great. Thank you. The next one to you again, Pallavi. The donor's family is charged for donating organs.
No, in fact, they're not charged at all. According to the law, the billing for the donor family will stop the moment they give consent to organ donation. So if at 12 o'clock they agreed to organ donation, their billing will stop. there is a lot of tests that are performed. The person continues to be on the ventilator till such time all the procedures are done and the body is taken into the OT. There's a lot of expenditure involved, but that is not billed to the donor family. That either the hospital takes care of or it is billed to the recipients. Many hospitals also, as a mark of respect, if the family had just come in the previous night, they waive off the entire bill. But according to the law, the billing will stop the moment a consent comes. So
that's
they're not
wonderful.
charged.
Dr. Jauhari, the next question to you, I think you've already answered this, but just a quick yes or a no. Anyone can be an organ donor.
99.9%.
That's wonderful. That's great. It is a fact. One more, Dr. Jauhari, for you, only the heart, liver, and kidneys can be donated.
No, we already told you about 8
Yes.
organs and any number of tissues. So,
Thank you
if
for
somebody wants to
reiterating.
give, you can give.
Great, and thank you for reiterating that point. Pallavi, again, to you, a person under the age of 18 cannot take decisions on organ donation.
That's right. According to the Act, a living donor definitely has to be above 18 years of age. But in case of a deceased donor, the parents are the decision makers. So we've had children as young as a few days old who have been donors, but that's only in the case of children who died. But a living donor has to be 18 and above, as per the law.
Okay, great. Dr. Jauhar, for you, if the ICU doctors know that a patient is an organ donor, they won't work hard enough to save the patient.
I'm glad you asked this question. Underline it 100 times, totally wrong, because the treatment of a donor, potential, alive or dead, is exactly the same, and it continues, as if the person is going to survive. And during this period, when you examine and you find that the person is brain dead, then you continue with the same treatment to make sure that the organs are in pristine condition. And if they are not going to donate, then obviously then you start talking about discontinuing. But the treatment will be exactly the same. There's no difference.
Well, that's great. Thank you for that.
Conversation of organ donation only comes up once death is declared by a team of 4 doctors, repeated. Till that time, a person is a patient for the hospital
and well taken care of.
Absolutely.
Okay, great. Pallavi, the next one to you. While awaiting transplant, the rich and famous get priority.
That's not true at all. And I'm very proud to say that we have fairly robust systems in place now. At least most of the states that have defined organ transplant programs have state registries. A person who wants an organ has to be a patient of a hospital and has to be on the waiting list of the hospital. Hospital hands over the waiting list to the state waiting list. And there is a fairly transparent, systematic and equitable system in place. Right, Dr. Jauhari?
I'll just add one more thing to that. About 35, 40 years ago, when we were doing transplants, at that time, you could, to a certain extent, with some justification, say that it was a disease treated for the rich by the rich, because the medicines were very expensive and we were not able to do. Today, in the last 30, 35 years, every single prime minister, every single chief minister has from their relief funds given funds for the poor. Every single major organization, every single insurance company is giving funds for the... Today, recently, Prime Minister's Jan Arogya Yojana and the other one, I'm a member of that. Anyway, we are talking about bringing the cost of transplant down to less than 5 lakhs. Now, how are we going to do it? I don't know, but we are going to do it. And this is definitely not a treatment for the rich, is it? We are bringing it down to the economically weaker section in every possible way. Medication. There are hospitals in the country where the treatment is after transplant also. The medication is free of cost. Forget about the transplants. So it is no longer true that it is a very elitist kind of treatment. No, it is very much a treatment for the common man.
There are multiple schemes in place, and we should urge your listeners to be alert to that fact that there are schemes in place and to actively look for them if the need arises.
Thank you. I'm so glad both of you answered this question. Pallavi, the next one, the last one to you is, Having a donor card is all that's required to become a donor. If a person writes in a will about his or her organ donation, he or she need not inform the family. Is it true?
In our country, as per the law that we have, the family in charge of the deceased person is the final decision maker, no matter what you have done during your life, whether you've written a will or you've written a card, the family will be consulted and the family's decision is fairly sacrosanct in our country. So, yeah.
Okay, thank you for clarifying that. Dr. Jauhari, the last one to you is organ donation will make the body look ugly. Myth or fact?
For a live donor, now with laparoscopic surgery, you got a few punctures here and there. And the retrieval of the organ again is in a very, very cosmetically acceptable way, well within the bikini line in most people, at least for the kidney, and for the recipient as well. All right. No, we don't mutilate. Definitely not. And for the donor, no. Because cadaver donor, at least the deceased donor, no, because you have an incision which is closed in the abdomen for the chest. If you are taking out bones or things like that, you have got splits. Eyes also, if you want, people, you have got the artificial kind of lens which they put in the eye, and you can close that. There's no mutilation. No.
Thank you both for your words of wisdom. This was indeed a brilliant session, and you've given a lot of information and shared your knowledge with the viewers. So thank you so much for being on this discussion. Thank you, Pallavi, and thank you, Dr. Jauhari.
Thank you so much.